I just kind of realized that I'd make my movie about my autobiography called All Great Men Are Dead and I'm Not Feeling So Well, the biography of Conrad Fischer. Oh, vasculitides. So what do we have in common, all the vasculitides? Polyarteritis nodosa, good pasture syndrome, sort of vasculitis, microscopic polyangiitis. All of the vasculitides all have fever, fatigue, weight loss, muscle pain, joint pain, all of them. All the vascular, well, it's an inflammation of blood vessels now, isn't it? So that means polyarteritis nodosa can give you a stroke. Lupus can give you a stroke. Microscopic polyangiitis. Granulomatosis with polyangiitis. GPA, the artist formerly known as Wegener's granulomatosis. Churg-Strauss, which is eosinophilic GPA. Let's not learn the same thing over and over. Let's just say all of them can give you inflammation of the blood vessels around large nerves. Large nerves, large enough to have names. And now vasculitis is now going to become one of the easiest things for you to learn, because you go like, what are you talking about, man? All of them are like the same thing. They all give you glomerular disease. They all can put you on dialysis because they all give you inflammation of blood vessels and your brain and your skin and your kidneys and your guts. Right now, I'm just a little petechiae, but when I grow up, I'm going to be a big purpura. And the anemia of chronic disease. My hepcidin goes up and my ferroportin is down, down, down. My hepcidin is up and my ferroportin is down, down, down. Hepcidin goes up because when you have inflammation, the liver makes a protein, liver, cidin, and it damages your ability to move iron around the body. They all can give you a high SED rate and C-reactive protein. And anybody who thinks that this is different, SED rate, C-reactive protein, I've never really thought that they're any significantly different. So polyarteritis nodosa, what's different about it? See, they all cause GI, joint, skin, renal, brain, fatigue. But polyarteritis nodosa does not go into lung much. Polyarteritis nodosa does not go into lung and is associated with the inflammation of hepatitis B and C. So the hepatitis B and C as a cause of polyarteritis nodosa is actually going down because the rates of hepatitis B in the United States gone way down. Hepatitis C should go way down too. It really should have gone much more down because we went to universal testing for Hep C, very easy treatment for Hep C, one pill once a day for 2 to 3 months, valprospir, sofosbuvir, glecaprevir, sofosbuvir. You'd think that like everybody just get rid of it like, you know, flossing. And with the other thing about polyarteritis nodosa, why do we look at the GI angiogram? Well, the most accurate test is actually a kidney biopsy because we can't biopsy the lung. Good pastures, we have basement membrane antibodies. Wegener's GPA, we have lung biopsy, microscopic polyangiitis, ANCA-positive vasculitides, we biopsy lungs. You see, polyarteritis nodosa spares the lungs, and kidney biopsy is the most accurate test. But the thing is, kidney biopsies are really dangerous. You're putting a needle into a retroperitoneal structure and they bleed, and that's why we go looking for a GI angiogram. Inflammation of blood vessels around nerves, the vasonervorum. I always hate that one, right? Is it mono or is it multi? Is it a neuropathy at a movie theater? A mononeuritis in a multiplex? 2 nerves large enough to have names. 2 nerves large enough to have names. So you've got to, for vasculitis. Vasculitis in its way, is like cancer. You've got to have histology to see it, hold therapy, and get a diagnosis. Angiography tells you the narrowing of the blood vessels. Now, angiography is the most important Takayasus, because in Takayasus, it's really a big blood vessel, the subclavian, and nobody wants to be going to biopsy a subclavian artery. But the angiography tell narrowing of the renal, the mesenteric arteries. And you see beading. Beading looks like beads. How many beads do we really know about? Narrowing, open, large, open, closed, open, closed, open, closed. And this thing about anemia, high sed-rate, it's anemia because it's anemia chronic disease. And it's going to sound quite repetitive now because it is. P-ANCA, C-ANCA. And whether you call it P-ANCA or myeloperoxidase, or C-ANCA, or antiproteinase 3. I never quite understood that. Why do we call them P-ANCA, myeloperoxidase, and the C-ANCA, proteinase 3? Change my name. I don't love you anymore, Conrad. I'm bored with you in the relationship. Nobody's actually ever said that to me, but the thing is, maybe you did. Well, then call me John, call me Bob, change my name. The urinalysis in all of these will show it's a vasculitis, it's damage of the glomerulus. And as damage to glomerulus, proteinuria, because you're damaging glomerulus, hematuria, dysmorphic, misshaped red cells, or they're going through glomerulonephritis. All forms of vasculitides needs steroids. Our beloved Dr. Fauci, why is he famous? You know, he's not an infectious disease doctor. Fauci is an allergist. And he said, you know, when you have GPA, Wegener's granulomatosis, if you give cyclophosphamide, it changes it from 90% fatal to 90% treatable. And you get rid of the hepatitis. Well, wait a second, fishy. That wasn't about GPA. There was polyarteritis nodosa. It's actually exactly the point. It is exactly the point. Because vasculitides are so much in common. Now, polymyalgia, polyarthralgia, polymyalgia, polyarteritis, polymyalgia, polyarteritis nodosa. No. Polymyalgia. This is an inflammation. It's an autoimmune inflammation, but it's not the same type of inflammation as vasculitis. It is your muscles on fire with stiffness and pain of these muscles. You can't get out of your chair without your arms. Hold your arms together and get out of the chair. I cannot do it. Polymyalgia rheumatica. Hold your arms together. Don't use your arms to get out. Polymyalgia rheumatica. Also, I can't. This concept of combing the hair, not my thing, right? He said, what makes you bring your arms above your head? That's a proximal muscle weakness. Proximal. Do you know there are going to be things that you never saw that you're going to diagnose? You see, one of the things about medicine is that there are going to be a bunch of things you're only going to diagnose because you learned about them in a step 2 or 3 course. So the first time I saw polymyalgia rheumatica, I had actually been teaching step 2 classes. And the guy goes, I am dying, I cannot get out of my chair, I'm sleeping, sitting up. This guy from Sweden. And he said, I can't get up. I thought, Dr. Fischer, I used to be able to go on the Nordic track an hour a day. And he couldn't comb his hair, he couldn't get up, and he was 75 years old. And he had a high sed rate, and he got low doses of steroids from me. 20 milligrams, 30 milligrams of prednisone. And he goes, you have saved my life. It's one of the first times about 25 years ago, a person said, "You have saved my life." So when they tell you your friends who go into the finance industry or in tech, do they get somebody saying, "You have saved my life. I thought I was dying. I was so fit. I'm 70 years old, 75 years old. I could go on every exercise, but I couldn't get out of my chair. I couldn't comb my hair. I couldn't get up, and I thought I'm dying." And he gets a little prednisone, bam, and he's cured. Giant cell arteritis, I don't love having polymyalgia rheumatica and giant cell arteritis put together because they're really so different. Giant cell arteritis is not a thing really presenting with, I can't get out of my chair, I can't stand up without using my arms. And they both give you high SED rate and high C-reactive protein. But you see, the issue about pain and tenderness on your scalp is different than I can't lift my arm up. Pain and tenderness when I touch my head is very different than I can't lift my arm up. Jaw claudication, because the artery is damaged and narrow. Then they can all give you high SED rate and C-reactive protein. Now, if you have a negative biopsy of one temporal artery, you're supposed to do the other side. How come I can do a temporal artery biopsy, but I can't do a subclavian biopsy? Because you can't chop holes out of your subclavian, but you don't actually need your temporal artery. They both get better with steroids, but the difference is polymyalgia rheumatica is a muscle pain, but not tenderness. So the guy had all this pain and his weakness, and I did this. How's that feel? I'm okay. Didn't hurt. Muscle pain symptom, but not tender, a sign. Muscle pain is a symptom, but didn't hurt in physical examination. How do I get you off of prednisone? Tocilizumab. Tocilizumab is an interleukin drug, gets you off of those steroids. Tocilizumab. Tocilizumab, interleukin 6 drug inhibitor, gets you off. Giant cell arteritis gives you aneurysms because it inflames your big blood vessels. And if you wait, and by the way, it's a classic. It's a stupid. We can't use the word stupid. Okay, stupid. You see, if you have that sort of pain and tenderness, inflammation, actually you can feel the temporal artery. You actually can feel it. It's large, it's painful, it's tender, and you have visual disturbance, and you don't give steroids. Tocilizumab is to help you get off of steroids because the interleukin 6 drug, which we can use for very severe COVID, helps you get off of steroids. I wish we could call it Wegeners. I miss Wegeners. Wedgie, where are you, Wegener? I miss you, Wegeners. Do you have pain? Yes, but so does microscopic polyangiitis. Do you have fever? Yes, but so does Churg-Strauss. Yeah, weight loss? So does Eosinophilic GPA. So does microscopic polyangiitis. All the vasculitides give you pain and fever and weight loss. High SED rate, C-reactive protein. It causes you to have GI bleeding, strokes at an early age, petechiae and purpura. Oh, that's what they all have. But they don't all have upper and lower respiratory. Yeah, but does this have abdominal pain with hepatitis B and C? Oh, no, abdominal pain with hepatitis B and C is polyarteritis nodosa. So GPA's biggest findings is upper respiratory findings. Upper respiratory findings. Because a lot of them can give lung, GPA gives lungs. Microscopic polyangiitis gives lungs. EO-GPA gives lungs. Polyarteritis does not. And so what's different is that GPA, we're not supposed to say Wegeners. The big issue is that it gives upper respiratory findings. A lot of them give ANCA. You don't mean to say ANCA, you mean to say proteinase 3 or myeloperoxidase, not myeloperoxidase with GPA. These anti-neutrophil cytoplasmic antibody diseases. Biopsy, most accurate. C-ANCA, proteinase 3. P-ANCA, myeloperoxidase. Wegener's is C-ANCA. Microscopic polyangiitis is P-ANCA. Now, the other way of talking, I went looking for, Dr. Fischer, it's not my fault. I went looking for ANCA. I went looking for C-ANCA, P-ANCA, CANCA, PANCA, SHMANCA, FANCA. I didn't see that answer. Well, they call it a qualitative autoantibody? Yeah, maybe they call it a qualitative autoantibody. Wedgie, lung biopsy. PAN, not lung biopsy. Why not do the sinus biopsy? There's all those upper respiratory things because the sinus biopsy is a lot more false negatives, a lot less accurate. Now, if they give you the choices here, lung, why not the kidney? Kidneys cannot be tamponaded, cannot be pressed, and the kidneys are under a much higher pressure. Let's put it this way. The afferent arteriole is 45 millimeters of mercury. 45, doesn't seem big, does it? Oh, your systolic pressure is 120 to 140, but 45 millimeters of mercury is actually quite large blood pressure, quite large pressure. That's the pressure in the afferent arteriole. But pulmonary hypertension, the whole pulmonary arteries, only 20. Above the pressure of 20 millimeters of mercury is pulmonary hypertension. So when you have these choices, you choose the lung biopsy because it's much less pressure. And when you need to use, we said, Wegener's has a greater mortality than metastatic cancer. You have a 90% 2-year mortality at GPA, Wegener's, GPA, Wegener's. When you add cyclophosphamide, you've completely changed your life. Rituximab. And so when you need steroids for long-term HIV negative, now, all due respect, with HIPAA compliant, and I'm not giving you a name, we had a very important faculty member in our department, and she had a very significant autoimmune disease. And she went to the hospital, she was short of breath, and she's on steroids, methotrexate. The lady had pneumocystis pneumonia. Nice 47-year-old Gujarati lady, one of my associate program directors, wonderful human being. And it's only because the other associate program director went over and go, why don't you get a 1,3-glucan? Because when you are using long-term steroids, this amount, why? Because the human body makes 15 milligrams a day of steroids. I probably make 20, because Dr. Fischer, when you meet me in person, I'm a big dude. I'm half a foot taller than most people. And so when you see that level of steroids for long term, you end up having HIV negative pneumocystis. So you can use steroids with cyclophosphamide. You can use steroids with your favorite rituximab. For Wegener's GPA, eosinophilic GPA. Now, eosinophilic GPA we use the interleukin drugs too for this, because the eosinophilic GPA, the former disease known as Churg-Strauss, we can use medications like interleukin inhibitors to stop eosinophils. Now, unresolving pneumonia not better, but avacopan, what is that? KSSO. Avacopan. Okay, look, this is not a review course for some of you, because as they say, you cannot review what you never knew. Avacopan is like eculizumab, but it's a C5 inhibitor for vasculitis. Avacopan, I don't know, is 2020 new for you? Is this too new to be an exam? No. 2020, that's new? Eosinophilic GPA is pulmonary renal asthma and eosinophils. Asthma and eosinophils, and this is actually a really easy disease. It's a really easy disease because, like all the others, fever, weight loss, night sweats, fever, weight loss, joint pain, skin findings, SED rate, C-reactive protein, normocytic anemia, GI bleeding, a stroke at a young age, GI bleeding, stroke at a young age, petechiae, purpura, everything we just said about all the vasculitides, but the difference is biopsy is the most accurate. That's not different. Why are you saying it's different? It's not okay, it's not different as all of them. Use steroids. Oh, yeah, that's really unique, Conrad. Steroids for an inflammatory disorder. That's incredibly unique. Thank you so much. What we're trying to leave you here with is the sense that GPA, EO-GPA, polyarteritis nodosa, microscopic polyangiitis, they're almost the same disorder with some variants. You see, EO-GPA, Churg-Strauss syndrome, is the interleukin drugs because this is an eosinophilic disorder. It's an eosinophilic disorder, and this gets you off of chronic steroids. Asthma eosinophils. What? Ooh, that's a good question. Which asthma medication causes eosinophilic GPA? That's why Zafirlukast is dead. But it's also the question, isn't it? This is not general learning. So let's be very clear. It is our consummate, passionate, deep wish that you all learn everything you need for humans. But this is not non-specific. Let me tell you what I do in my lab. This is how do you get the questions right on a test? And so this thing here, Zafirlukast, what's the one question? It's a drug that causes eosinophilic GPA. Cyclophosphamide, I was with a very significant attending who is finished a nephrology fellowship and said, what's the most common adverse effect of cyclophosphamide? And the wrong answer was hemorrhagic cystitis. The right answer is chicharrones de cojones. It cooks your testicles, man. Chicharrones, cojones, it makes testicle falafel. And the hemorrhagic cystitis, which can be prevented with joining Mensa. Not joining Mensa, MESNA. Mensa is a genius organization. MESNA prevents hemorrhagic cystitis and the inflammation causing bladder cancer. This is an alkylating agent. Microscopic polyangiitis, let's say the same thing over again. It causes fever, weight loss, anemia, high SED rate, high C-reactive protein. We can see people who have GI bleeding. We can see a stroke at a young age. We can see petechiae, purpura, petechiae, purpura, vasculitis. We can see mononeuritis multiplex as we have inflammation of the blood vessels around nerves. Okay, that's all of them. So what's different? That's all of them, isn't it? No EOs, no asthma. Not Church-Strauss, not EO-GPA. Not upper respiratory findings. No granulomas. And they all have the most accurate test of biopsy. Without a biopsy, you cannot distinguish these from the others. They all are treated with steroids and cyclophosphamide. GI pain, bleeding, vasculitis, it must be a vasculitis. That's a vasculitis. How do you know it's a vasculitis? It's a vasculitis. How do you know? How do you know just because there's petechiae and purpura, a little petechiae, big purpura, inflaming the joints? Vascular disease causing glomerular disease and hematuria. Biopsy, how do you know it's a vasculitis? Because we're in the vasculitis section. GI joint, skin and renal, GI joint, skin and renal, GI joint, skin and renal, GI joint. I can't learn it. Leukocytoclastic, it sounds impossible. Leukocytoclastic vasculitis. That's 11 syllables. I'm not that cunning linguist. Henoch-Schönlein, GI joint, skin and renal, 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 GI joint, skin and renal. Henoch-Schönlein purpura. And the thing about Henoch-Schönlein is if you diagnose it, you definitely know if you use this medication, everything gets better and reverses it instantly. Oh yeah, nothing. There's nothing that reverses IgA diseases. Now, what do you mean nothing reverses? Most resolve spontaneously. Reversing spontaneously is not the same thing as saying we have a treatment to make it get better. It's not the same thing. Nothing makes it get better that we know of. Sparsentan with an SS, spar with an S, sentin. Sparsentan is an endothelin and angiotensin inhibitor. Endothelin, angiotensin. Sparsentan, that's for IgA nephropathy. Sparsentan. That's for IgA. Angiotensin, endothelin. Angiotensin, endothelin. We use steroids for bad disease. You've got pain, your kidneys are failing. Man, I can't just do nothing. I'm going to give you some ACE and some ARB to help protect your kidneys. I'm going to give you some ACE and some ARB to protect your kidneys. Fish oil is total govno bullshit. Hada govno. I can't give you that. This fish oil is nonsense. Sparsentan, endothelin, angiotensin, endothelin, angiotensin. That is for IgA nephropathy. But this is an IgA disease. I know, but sparsentan don't work for this. So you give steroids and ACE inhibitors to decrease proteinuria, but it's not the same thing as saying that it reverses. So there's like aging. It's like aging. What can you give to reverse aging? Pornography! It doesn't reverse aging. It may make you feel younger, but it doesn't reverse. Having more children. Oh yeah, nothing like. These things delay progression. Delay progression. What's the difference between a cryoglobulin and a cold agglutinin? A cold agglutinin is hemolysis. Cold agglutinin, Epstein-Barr mycoplasma. Epstein-Barr mycoplasma. Cold agglutinin doesn't give you skin lesions. Cold agglutinin doesn't give you kidney disease. Cold agglutinin is not associated with hepatitis A and B or C. Cold agglutinin is not a vasculitis. Cold agglutinin, not a vasculitis. Cold agglutinin does not give you joint disease. Cold agglutinin is not associated with chronic infections. But cryoglobulins are. Cryoglobulins, cold agglutins, both in IgM. Cold agglutinin and cryoglobulins are both IgM. Neither of them does really well with steroids because IgM. So if it's just an IgM, you don't get better bunch with steroids. But cryoglobulins causes these purpuric skin lesions. If you press on them, what happens? Nothing. If you press on this, nothing. If you press on it, it doesn't blanch. Blanche. Blanche is a $5 French word for turning white. You don't have blanchfleur. Blanchfleur, which is to say white flour. It doesn't turn white because the blood vessels are damaged. When you have a decrease in platelets, the blood vessels are damaged, the blood goes across. Lupus C3, come on. Dr. Fischer, did you really become a full professor of medicine with a bullshit thing like SLE, 3 letters, complement 3? Hep C, 1, 2, 3, 4, decrease C4, 4 letters? I don't know, maybe. Cryoglobulins, sometimes it's mixed. Sometimes it's mixed with IgG. Sometimes it's mixed. Most of the time we don't know what causes it. What causes it? I don't know, but it's essential. You gotta have it. But it's mixed. Well, kidneys, skin, GI, brain, high sed rate, C-reactive protein. If it's IgM, IgMs don't get better with steroids. But if it's essential, idiopathic, mixed with what? IgGs. IgG gets better with steroids. Rituximab, let's get rid of the cells that make the immunoglobulins. Rituximab, CD20 drugs, get rid of the cells that make the immunoglobulins. Yo, dude, you just did, why you assassinate? You jumping on me with cold agglutinins? You're trying to screw me up. This disease, cold agglutinin disease, doesn't actually deserve to be in vasculitis. Well, then it's your course, asshole. Why do you have it here? First of all, be respectful. That's Dr. Asshole to you. And so it's here so you don't mix this up. You just said mixed cryoglobulins. The point is, so when I was, I want you to be better than I was. At the time, I was a 4th year student, 5th year student, intern, 2nd, 3rd year resident. I didn't know what cold agglutinins and cryoglobulins, the difference was. And so cold agglutinins is the cause of hemolysis with Mycoplasma and Epstein-Barr. And it doesn't cause all that high sed rate C-reactive protein. Cold agglutinins doesn't cause skin lesions, kidney disease. But you mix it up. You do. Trust me, you do. Let's be wrong now. So we have something different. Sutimlimab, pegcetacoplan. These are anti-complement C1 and C3 drugs. What's really amazing is we have different ways to inhibit the complement system that's attacking your red cells and other things. And also, what's so amazing about pegcetacoplan is its effect upon dry or geographic or dry macular degeneration. I am delighted, thrilled, euphoric to present to you the first ever significant therapy against dry. Wet macular degeneration is VEGF inhibitors, and pegcetacoplan against dry macular degeneration. Rituximab gets rid of the lymphocytes to make antibodies. Lymphocytes get antibodies. Time to go to LSU. Behçet's disease, there's nothing new, it's just that Behçet's a complicated disorder because Behçet was a Turkish dermatologist. Behçet was a Turkish dermatologist who described people who had these oral and genital lesions, erythema nodosum, ocular lesions, vasculitis causing pulmonary aneurysms, pulmonary artery aneurysms, and like all vascularities can give joint pain. But what's different and unique about it, this is called hypopyon. That's pus, where the white cells are so prolific, they're actually accumulating in a bucket at the end of your cornea. And circinate balanitis in your tongue. Circinate balanitis. Quite an odd and unique term. This is one of the unique terms, a term used nothing. Circinate means in a circle. Circinate in a circle, why don't you call it circular? Balanitis. It's not just for Behçet's. Balanitis. Balan is inflamed. Your balan is inflamed. That's the head of the penis. It's quite strange. It literally means acorn. Something looks like an acorn. Somebody decided, I don't know what an acorn, I don't know what an acorn looks like. Maybe it looks like the head of your penis. Yeah, acorn, an inflammation of the acorn, the head of the penis. Pulmonary and coronary aneurysms. Pulmonary and coronary aneurysms. This is why Behçet's is hard for people. Look, it would be hard for me. It takes a long time to make a Conrad Fischer. Pathergy. Look, there's no test for Behçet's. Look, if you've never seen it and you're not familiar, it's a really hard disease. It causes pain and ocular problems, ocular and genital and skin, and you scratch the skin and it causes inflammation. There's no lab test. Even familial Mediterranean fever has the MEFR gene, but there's no gene test. The Mediterranean fever gene, MEFR, Mediterranean fever gene. Ocular problems, skin problems. Dr. Fish, I don't know, maybe I'll just give a bunch of steroids and figure it out later on. Colchicine to get you off of steroids. So it depends. It depends what part of the world you're from, and this might be a really easy disease for you. But when you have an inflammatory T-cell disorder, and you don't know what to do, azathioprine. And an inflammatory T-cell, thalidomide, lenalidomide. I thought that was used as an anti-inflammatory TNF drugger for myelofibrosis, myelodysplasia. Ooh, yes, that's true, I do. Behçet's, arterial and venous thrombosis and dilation. So, in what we've done here, there's no such thing as quote unquote high yield for step 2. Everything is there. Everything. Oral ulcers, but here's the last thing. This drug can be used with eczema and sometimes atopic dermatitis. This drug can be used, there are so many phosphodiesterase inhibitors, and it ain't theophylline, which is for asthma. It's not roflumilast, which is for COPD. It's not, theophylline for asthma. It's not roflumilast for COPD. It's not crisaborole for our skin lesions. Apremilast for Behçet's, not responsive to steroids and colchicine. Now, Takayasu's arteritis is actually a very easy disease for us because you've lost your pulses. And basically, huge, big blood vessels. Because one of the big differences is that Takayasu is a disease of really big blood vessels, big enough to make you lose your pulse. And so the most common wrong answer is biopsy. The right answer is an angiogram looking for the narrowing. Because we're in the vasculitis section, you can use steroids for everything in the vasculitis section. Now we have a tour through all. Methotrexate doesn't need steroids. Rheumatoid arthritis. Azathioprine doesn't need steroids. Chronic inflammatory bowel disease. Leflunomide. I've rheumatoid arthritis and I can't use methotrexate. And all of these, like tocilizumab, get you off of steroids in giant cell arteritis. I inhale great drafts of space, the east and west are mine, the north and south are mine, and I now can absorb enormous amounts of knowledge, and I allow myself to be permeated, perfumed, and flavored with the great knowledge of the universe. Welcome it, seek it out, desire knowledge as something lovely, true, good, and beautiful, as in the epistle to the Philippians.